In this episode, we'll unpack the Saskatchewan ER crisis with a deep dive into its historical roots, the perspectives of doctors, patients, and policymakers, and its ripple effects on communities like those in New Brunswick. We'll explore how Health Canada and provincial governments are tackling this issue, compare Canada's approach to global peers, and propose realistic solutions to ensure equitable healthcare access. Plus, we'll share a quick Health Canada update to keep you informed. So, grab a coffee, settle in, and let's get started. Have you faced healthcare access challenges in your community? Share your thoughts on X. We'd love to hear from you. To understand why rural Saskatchewan's ERs are closing in 2025, we need to step back and look at the historical forces that have shaped Canada's rural healthcare landscape. This isn't a new problem, it's the culmination of decades of systemic challenges, demographic shifts. The rationale was efficiency. Small hospitals were underutilized, and consolidating services would improve care quality. A 2001 study found that these closures didn't significantly harm health outcomes, as residents adapted by traveling to larger centers. But the closures left a lasting mark, fostering resentment and fear that local healthcare was being eroded. Fast forward to the 2000s, and Canada's healthcare system began grappling with a growing doctor shortage. A 2017 Vancouver Sun article warned that the shortfall of nearly 500 ER doctors could triple by 2025, a prediction now playing out. The aging baby boomer generation, both as patients and retiring physicians, exacerbated this crisis. By 2018-19, experts like Dr. Francois Wrights foresaw a mass retiring of doctors, a trend accelerated by the COVID-19 pandemic, and policy decisions, many of which resonate with New Brunswick's own rural healthcare struggles. Canada's rural healthcare system has always faced unique pressures. In the early 20th century, Saskatchewan's pioneers passed the Union Hospitals Act in 1916 to build small community hospitals, funded by local taxes, to attract doctors to remote areas. These Union hospitals were lifelines for rural residents, providing basic care and emergency services. However, by the 1960s, the introduction of universal Medicare under the Saskatchewan Hospitalization Act shifted the focus toward larger urban centers, where advanced care was more accessible. This reduced the scope of rural hospitals, limiting them to minor procedures and primary care. In 1993, a pivotal moment occurred. Saskatchewan's NDP government closed 52 small rural hospitals, converting them into primary care centers.